Good evening. A dire message from the union representing 40,000 hospital workers in Ontario tonight. At a press conference here at Scarborough General Hospital, they warned unless Toronto area hospitals hire more staff in the coming months, problems with spiking emergency room wait times and staffing shortages will only deepen.
This is not normal nor acceptable.
After a summer that saw dozens of hospitals close their ICUs and emergency departments due to staffing shortages, hospital workers are warning the situation is about to get worse.
We have a workforce that is exhausted, demoralized, and looking for the door after struggling through this pandemic.
The union says hospital staff are leaving the workforce at double the rate of pre-pandemic levels.
This attrition weakens our healthcare system that has had the fewest staff to population than any province for decades.
And the average hospital wait time in Ontario has spiked this year to 20.7 hours. CUPE says the only way forward is to hire staff and fast. 15,000 healthcare workers would have to be hired this year alone just to maintain current service levels in Toronto. 46,000 staff province-wide. The union has come up with these numbers based on existing vacancies, high turnover rates, and to meet the pressures of an aging population.
We've been sounding the alarm bells about this shortages for months, and there's been no comment from this government. And quite the opposite. They've denied that there's a crisis.
The union says the Ford government needs to repeal Bill 124, which caps public sector wage increases at 1% annually. But the Ministry of Health is touting its plan to help stabilize the healthcare system. In a statement, they tell us in part, once fully implemented, the next phase of the plan to stay open will add up to 6,000 more healthcare workers, free up over 2,500 hospital beds, and expand models of care to avoid unnecessary visits to emergency departments.
The situation is extremely dire.
The unit chair for Toronto Paramedics Services says he isn't confident his colleagues can respond to emergencies in a timely manner.
32 years, I have never seen elderly patients that slip and fall on the ice and fracture a hip and lie out on that ice for hours in agony. I have never seen that in 32 years.
He says paramedics are averaging a resignation once a week.
We need to find an incentive to keep medics in Toronto, a monetary compensation for working in this city, and all that comes with working in this city, the gunshots, the opioid crisis, everything else.
Toronto paramedics say 500 medics are needed now to bring the system to a reasonable level. The Ministry of Health also added it's looking at other ways of hiring more staff, for instance, finding ways that internationally registered physicians can register here in Ontario.